Thank you to the conference organizers for the opportunity to present to you today. I will be speaking about the experiences of participants in a decentralized HIV medication distribution program in South Africa during the COVID-19 pandemic. I declare no conflicts of interest. 4.8 million people living with HIV are on antiretroviral therapy in South Africa. In 2016, the Department of Health implemented the Central Chronic Medicine Dispensing and Distribution Program, referred to as CCMDD, to decrease barriers to ART access. The program enrolls stable, virally suppressed patients. As illustrated here, enrolled patients can collect their ART refills from community-based pickup points, such as churches, schools, and private pharmacies, instead of requiring clinic visits to collect medication. Recently, South Africa has been significantly impacted by the COVID-19 pandemic, with over 118,000 confirmed COVID-19 infections as of June 26th. In response to the pandemic, the President instituted a national lockdown in levels of decreasing restrictions. Level 5, implemented on March 27th, included a strict stay-at-home order with significant restrictions on public transport. Level 4, implemented on May 1st, loosened restrictions on leaving home and resumed some public transport with strict hygiene conditions. Such restrictions may have significant socioeconomic effects on vulnerable populations and adversely impact long-term HIV care and access to ART. Furthermore, levels of medical mistrust and stigma related to COVID-19 are not yet understood in this population, but could exacerbate barriers to ART access and impact personal experiences during the pandemic. The primary objective of our study was to evaluate the experiences of people living with HIV participating in the CCMDD program in South Africa during the COVID-19 pandemic and national lockdown, with a specific focus on concerns regarding the COVID-19 pandemic, new barriers to ART access, mistrust in the government and healthcare sector regarding COVID-19, and level of stigma associated with COVID-19. We contacted a randomly selected subsample of participants previously enrolled in a prospective cohort study of the CCMDD program in urban KwaZulu-Natal. We administered semi-structured telephone interviews to consenting participants. Interviews were conducted between April 28th and May 22nd, 2020. Turning to the results, we completed interviews with 314 participants for a response rate of 49%. 66% of the respondents were female and the median age was 36. Participants had been diagnosed with HIV a median of 3 years prior. At the time of enrollment into the parent study, 55% of participants had an HIV stigma score of 0 on a scale of 0 to 13, with lower scores indicating lower stigma. 51% of respondents had been enrolled in the CCMDD program for less than 6 months at the time of the interview. The most commonly identified concerns regarding the COVID-19 pandemic and associated restrictions were those of food running out, becoming infected with COVID-19, being unable to work, and money running out. Additional concerns included a family member becoming infected, lack of transport, being afraid to move around outside, and unavailable PPE and hand sanitizer. 8% of participants reported that they had delayed picking up their ART due to concerns about COVID-19 and associated restrictions. 25% had noted changes to their ART pickup experience due to COVID-19, among whom 16% reported their pickup location had changed, 34% noted an increase in time or cost to travel to their pickup point, and 51% noted an increase in wait times at their pickup point. 68% of participants reported new concerns about picking up their ART going forward during the pandemic. Primary reasons for this concern were COVID-19 infection risk, lack of transportation availability and increased costs, and safety concerns related to travel or moving around. We used a modified mistrust scale to measure levels of mistrust in the ability of the government and healthcare sectors to inform the public about and to manage COVID-19. The median score on a range from 8 to 40, with higher numbers indicating greater mistrust, was 15, with the distribution of summary scores shown on the left. Distributions of individual answers for 2 sample scale items, one assessing mistrust and one assessing trust, are shown on the right. Finally, using an adapted HIV stigma scale, we assessed intrapersonal and interpersonal stigma associated with COVID-19. We utilized a 5-point Likert scale to assess agreement with statements such as, "A person with coronavirus must have done something wrong and deserves to be punished." On a score range from 6 to 30, with higher scores indicating greater stigma, the median score was 10. As seen here, the distribution was skewed towards lower scores, and over 25% of participants had the lowest possible score on this scale. In multivariate analyses, significant predictors of having a stigma score above the median included female sex and a baseline HIV stigma score in the top quartile, or greater than 6, when adjusted for age and education level. This study has several limitations. The interviews were conducted over a limited time period during the national lockdown, potentially missing changes over time in the impact of the pandemic on people living with HIV. Further, we are unable to compare or generalize our results to the population of people living with HIV not enrolled in a decentralized ART distribution program. Finally, we utilized adapted scales to assess mistrust and stigma, as there are currently few validated instruments available to measure attitudes related to COVID-19. In conclusion, among people living with HIV participating in the CCMDD program, primary concerns related to the COVID-19 pandemic were economic, along with fears of acquiring COVID-19 infection. 8% of participants had delayed ART pickup during the national lockdown, while 68% anticipated barriers to ART access in the future. While overall levels of mistrust and stigma related to COVID-19 were low in this cohort, female sex and higher baseline HIV stigma score were associated with higher COVID-19 stigma. I would like to thank my collaborators in the United States and South Africa, and I am happy to take any questions by email. Thank you.